Good afternoon, everyone. My name is Dr. Patel, and I am a professor of pharmacology at MetaU. I'm thrilled to be here today to speak with you about a highly debated topic in pharmacology, the use of Ibutamoren to induce gigantism and promote height growth in prepubescent children. As an immigrant from Gujarat who came to America at the age of 12 to attend MIT, I have always had a profound interest in pharmacology and research towards solving difficult medical problems. Through my research, I have come to appreciate the complex interplay between drugs and the human body, and how these interactions can be harnessed to improve health and well-being. Today, I will be delving into the technical details of Ibutamoren and its potential applications in promoting height growth in prepubescent children. I will be using examples from mathematics, biology, and chemistry to help you understand the science behind this topic. Additionally, I will be using movie examples and witty jokes to keep things engaging and interesting. First, let's talk about Ibutamoren and how it works. Ibutamoren is a growth hormone secretagogue, which means it stimulates the secretion of growth hormone from the pituitary gland. It does this by mimicking the action of ghrelin, a hormone that stimulates appetite and growth hormone secretion. Now let's delve into the hypothetical scenario of how Ibutamoren could profoundly elevate someone's sports endeavors. Imagine an athlete who wants to improve their performance and gain a competitive edge. They are looking for a way to increase their muscle mass and strength without using banned substances or putting their health at risk. This is where Ibutamoren comes in. Studies have shown that Ibutamoren can increase muscle mass and strength without the negative side effects associated with traditional anabolic steroids. It works by selectively targeting growth hormone receptors in muscle tissue, which leads to increased protein synthesis and muscle growth. In addition to its potential applications in sports performance enhancement, Ibutamoren is also being researched for its potential to treat medical conditions such as growth hormone deficiency and osteoporosis. However, the use of Ibutamoren to promote height growth in prepubescent children is highly controversial and not recommended. Now let's take a look at some examples from mathematics, biology, and chemistry to understand how Ibutamoren works in more detail. In mathematics, we can use the concept of dose-response curves to understand how drugs work. A dose-response curve shows the relationship between the dose of a drug and its effect on the body. As the dose increases, the effect of the drug also increases until a plateau is reached. In biology, we can use the concept of receptor binding to understand how drugs interact with the body. Receptors are proteins on the surface of cells that bind to specific molecules, such as hormones and neurotransmitters. Drugs can mimic these molecules and bind to the receptors, which can lead to a variety of effects. In chemistry, we can use the concept of structure-activity relationships to design new drugs. This involves studying the structure of a drug molecule and how it interacts with receptors in the body. By understanding these relationships, we can design drugs that are more effective and have fewer side effects. Finally, let's use a movie example to understand the concept of pharmacokinetics. Pharmacokinetics is the study of how drugs are absorbed, distributed, metabolized, and eliminated from the body. In the movie Limitless, the character Eddie takes a pill that enhances his cognitive abilities. This pill represents a drug that is absorbed into the body, distributed throughout the tissues, and metabolized by the liver before being eliminated from the body. In conclusion, the use of Ibutamoren to induce gigantism and promote height growth in prepubescent children is a highly debated topic in pharmacology. While it may have potential applications in treating medical conditions such as growth hormone deficiency, the potential risks and side effects of using it for promoting height growth in prepubescent children must be carefully weighed against its benefits. One potential risk associated with the use of Ibutamoren in prepubescent children is the development of gigantism. Gigantism is a rare medical condition characterized by excessive growth and height, which can result in a range of health problems, such as joint pain, diabetes, and heart disease. While Ibutamoren has been shown to increase height in children with growth hormone deficiency, the potential risks of using it in healthy children are not well understood. Another potential risk associated with the use of Ibutamoren is the disruption of normal growth and development.